Wellness starts with a we, teamwork. That means the dental department plays a huge role in cardiovascular disease. We have seen over the years and research that patients who have gum disease, lack of bone, and they have a lot of inflammation in the dental area. They have mercury, they have lead, they're losing tooth. These patients, they have higher risk to have cardiovascular risk, MI, or including angina or chest pain or discomfort, or including having C-reactive protein high, and that's higher risk to have heart disease and stroke. So that's why I put here, cardiovascular disease starts in the gut. It's very important how we chew, how we swallow, and if there is mercury in the dental, in the tooth, or there is lead, or there are any other metals or root canals or energy blockage here in the mouth, it will go directly all the way, manifestate all the way in the gut, and that can also interfere with our inflammation. That's why it's very important about this. Balance is the essence of life. In my background of omotoxicology, I think it's very important to understand that everything that comes in has also come out. So what comes in is nutrients, oxygen, and all the good things of your energy and emotion comes into your body and has to have a reaction, and that reaction is going to happen in the matrix or the kinetic tissue, or also called extracellular space, where everything is connected there. We have immune cells, we have nerve cells, we have lymphatic cells, system, and everything is connected. Life begins here. And everything that comes in has to have a reaction in the matrix, and then it goes to your cell. In every cell of your body, your cell will use all these good nutrients, and then they have to detox. That cell also has use all the good things, the oxygen, the nutrients, and also has to get rid of them. How is it going to get rid of them? By going back to the matrix and going through the lymphatic system and also to the venous flow. So that's why I put here, venous drainage is very important. Also detoxification of the liver, colon, skin, lungs, and kidney. These are the most important organs to help you to detox. And that's why it's an output. So it's important to have a balance between everything that comes in, including emotions, has to come out in an easy way, in a very harmony way. An example, fibromyalgia, one of the most common disorders, it's manifestate with fatigue, sleep disturbance, cognitive problems, and pain in your trigger points. But this is just an early stage of misbalance in your matrix and your lymphatic system and all around your input and output. When you have an emotion blocked, you have a dental or energy blockage that is manifestate as a fibromyalgia, then we have to understand that all this is coming from the matrix, where everything is connected. We have our capillaries, we have the capillaries from the venous, from the arteries, we have lymphatic system, we have nerves ending, we have everything there in the matrix. So this is just an early manifestation of heart disease. When I say about heart disease or cardiovascular disease, I'm talking about arrhythmias, I'm talking about heart failure, either if it's diastolic, systolic, if it is left ventricle, right ventricle, any type of heart failure. It can be related as a cardiovascular disease, enlargement or hypertrophy. We're talking about high blood pressure, atherosclerosis, coronary syndrome, stroke. So cardiovascular disease and heart, it is a very broad word. But here I put metabolic syndrome because it's very important that everybody is aware about metabolic syndrome and insulin resistance syndrome and how important sugar, insulin, and inflammation play a role in every of them. Most of our patient that comes here in Santa, we have found as a teamwork, because the chiropractor, the nutritionist, the psychologist, the dentist, including the fitness trainer, they know that if the patient doesn't have elasticity, they have a muscle restriction, and they have this restriction in stretching, we normally interpret it as a low nutrient deficiency and dehydration. So most of the problems that we have seen in our chronic degenerative patients that comes with metabolic syndrome or heart disease or insulin resistance syndrome, it's dehydration. They are not detoxifying correctly. They also have blockage on the liver, colon, skin, kidneys, or lungs, and that's why they have more inflammation in their body, especially if they have all the environment that I just put you before, of stress, of electromagnetic fields. They will have high cortisol, high insulin. They will have suboptimal hormone levels, could be testosterone, could be thyroid, hypothalamus, pituitary, and adrenal glands. So there is a lot of conditions that predispose these patients for inflammation, lymphatic clogging, and also energy blockage. So it's very important for you to know this is the most common findings. At Sanofi, we have a machine or a device that is well known to detect endothelial dysfunction. This is one of the most common problems in predicting heart disease, high blood pressure, and stroke or MI. And what it does, it just helps how rigid is the artery, how important is nitric oxide production in the endothelial, and how important is this manifesting in diabetic or high blood pressure or high cholesterol in patient with smoking or family history of heart disease in menopause and age. So in the top right square, when you see a normal blood vessel, you see all the green area where circle, that says nitric oxide. This is a very fine, relaxed, intima, media, and adventitia. This is the layers of the artery. So what happens in a patient who has all the risk factors? Well, they will have other molecules that will create oxidative stress and oxidative low-density lipoproteins, and that will create a lot of inflammation. Nitric oxide and other nutrients will be diminished as well with folic acid. So we are able to detect this in early stage in order to prevent any event. Also, one of the most common underlines that we have seen here at Sanofi is patients with adrenal fatigue. They normally, when I ask them, what do you do for life? And they say, well, I do this, and do you like what you do? And they are paddling against the current 24/7. They're doing something that they don't like to do. It's kind of a paddling against the current, and that is going to create more emotion and energy blockage into your detoxification and to the matrix, into the lymphatic, and that's going to create overwhelm of the cells, and they will not have the correct nutrients, and they will not detoxify correctly. So it's very important to do what you love to do and have fun. And I'm going to speak about vitamin G because I think it is so important. The vitamin G, it's from the ground. It's important how we need to be connected to the ground. Animal life. If the energy of the planet is changing, well, we have to stay close to the ground so we are able to. Our energy also goes along with those changes. And animals also plays a very good part. We're now flying. We're now flying, moving around, exposing to toxic from airplanes, from magnetic fields, recycled air. We are exposed to a lot of things, so now we have to go back to the ground. It is very important. That's one of my advice today. The lost in purpose in life, we often see this in patients, in elderly patients. They have kids, they have grandkids, they already have everything. So now we have to find another purpose in life that will motivate them to continue to have vitality and energy to continue. Absorption and digestion, one of the most important area of weakness, as I mentioned in the beginning of the presentation, is the mouth. So we have to make sure that we have a good nutrient from what we eat, how we chew, how we select the nutrients, and it's very important the balance of magnesium and essential fatty acids, because this is one of the most common underlines that we found in patients. Dental, as I mentioned, mercury and lead, as well with cavitation or any of the gum inflammation, makes a huge underline in cardiovascular disease. Pain, normally pain of fibromyalgia or pain in your joints also could be related to dehydration. Early this year, Aaron, our chiropractor, spoke about this, and I think it's very important that we follow his recommendation. It's very, very important. A good, clean, balanced pH water that will help you to find that balance in your cells. So once we address already the underlines of our patients, now we are going to go to the part of what do we do? How we organize information patient. If a patient comes to Centerview and has a file, that's very common here at Centerview, they have big, huge files. Well, let's organize the information. How we do that? Functional medicine trained us and give us a great tool, which is the matrix. The matrix is it's just a tool that we use to organize information. Once the information is organized in a matrix, which is a paper where we separate all the symptoms the patient have, we ask ourselves, why a patient come here right now and complain of heart disease, diabetics, and stroke and bypass. So let's go back and ask, what are the antecedents in the life of this patient that predispose him to what he has right now? What is the family background? What is the genetic background? What is the environment? And then we ask, what are the triggers? What are the triggers that predispose this patient to have a manifestation of headache or any other symptom, numbness, tingling, chest pain, or discomfort? What are the triggers? Could be a surgery, could be a trauma, could be a tooth decay, could be a impacted wisdom molar, could be a gum or cavitation. Let's find out why. And then once we found why, then we can understand what's going on with the patient. So we do every day a dialogue, discussion, and we come with this information. Once we have found in the medical meeting what happened to this patient in his life, and then what was the trigger, and then what's going on right now, well, now let's find out where to begin the treatment. Okay, now we found what's going on, we organize information, we know what's going on. Now where do we start the treatment? If it's digestive, if it's structural, if it's energetically, if it's emotion, if it's a family, let's say like a conduct, like if it's something that comes in the family or runs in the family, the problems, and well, we have to wait. We have a way to break this pattern, and so you don't have to bring that to your kids. So we decide where do we start, and then we do the treatment plan. We send the patient home. We give them the recommendations. We make goals. We work as a team with the family because it's a teamwork, and then that's how we do it. This is just a clinical example. Sorry. This is an example of a patient that is a truck driver. He's 37 years old. His father died of heart attack at age 43. He has a brother who has heart problems. He also has another brother with hypertension and diabetic in the family. So as you can see, this truck driver has all the risk factor to predispose him but not necessarily if his environment is not. Let's find out the environment of this patient. We already know that he has a genetical background that predisposes him. Now, let's find out what are the trigger events. Well, he eats fast food, high carbs. He eats the wrong food. He drinks a lot of alcohol. He also it's sedentary. As a truck driver, he's driving and especially has long drives. He has also a lot of stress financially because in a home, the economy is not very good. Also, he's a former chain smoker. So, as you can see, this trigger activated already what he is vulnerable to have in the genetical background, according to the antecedents. So what are the symptoms of this patient? Oh, normally he has chronic sinus infection because he normally is driving and using air conditioner and a heater. He's also not doing exercise. That's why also he has a lot of immune suppression. Most likely he has heavy metals. Digestion, he has heartburn because he doesn't eat very good. So he has constipation because he is not able to stop to have a bowel movement or urination. He is obese, sedentary. He has waist or like a central obesity. Oxidative stress, they normally have headaches, fatigue, foggy mind, numbness and tingling. This kind of patient, they normally have some weakness. Normally, patients have impaired detoxification because they are not because they have mercury amalgams. They have drinking alcohol. They're taking a pain medication. They're drinking a lot of coffee, so they are affecting his detoxification in the liver. One of the most important is he's gaining weight. He has fluid retention. And most likely he's not exposed to the sun, so he's going to have vitamin D deficiency. And as you can see, vitamin D is the new kid in the block that expresses more than 200 genes and regulates inflammation. And so this, as you can see, the whole picture, he has all the things to have heart disease, and we are able to detect them and to explain to the patient the history of where he's going and give that option to them. Okay, this is your options. Where you want to go? You want to be part of the statistics of 2020, or you want to change to this to have a good quality of life, prevent heart disease, and just enjoy what God has you to live. I think it's very important. So I hope it makes sense why there is a world epidemic. So what we do when we find all these underlines, we do tests. We check your C-reactive protein, homocysteine, your lipoprotein A. There is a complete cholesterol profile that evaluates the size of the molecule of the cholesterol in order to find out if it's really at risk or not, because it's no longer a risk factor to talk about total cholesterol, HDL, and LDL. That is a myth, and it's already not useful information to speak about only those three biomarkers. We have to do a complete profile of your cholesterol where you speak about lipoprotein and a lot of other more size of the molecules particles. We also have to evaluate insulin. We have to evaluate glucose curve and fasting insulin, and also the curve, cortisol. Let's find out how the flora of the gut. Maybe this is where it's going on. Maybe it's a food allergy. Maybe it's gluten related sensitivity. So there is a lot of tests that will help us to guide our patients to optimal health. This is the most interested, and I think this is where everybody's going to find some recommendations in the treatment plan. We want to make the difference, so it's very important to have early detection. I think Sanofi philosophy, and Dr. Wenz, when he created Sanofi, one of his main goals is to have healthy patients and to prevent and have a good quality of life, and also to detect early any underlying of genetical weakness there that can develop problems in the future. So it's very important to early detection. And family commitment, it's something that I have seen that is important when there is a couple here and normally they go back and they are stronger than either just one or the other. And then when they go back home, they want to make a lot of new things, ideas, but the family is not helping. So it has to be a family commitment. So some of the treatments, what we recommend is, first of all, we have to open the channels of detoxification, especially colon, by doing enemas or colonics. If the patient is able to do, we also help the liver detoxification. We use a lot of herbs and botanicals, help with the sauna to detoxify the skin, which is the biggest organ in our body. Help the lungs by breathing techniques is so important, because just by taking deep breath, you're able to detoxify a lot of the brain metabolism, because when we do a deep breath, we reduce intrathoracic pressure, and we help the drainage of the brain, of the venous flow. And if we ask how important is the venous flow, right now there is a worldwide, there is like a hot topic of CCSVI and MS. It's how important is the drainage of the veins. We need to help the drainage of the veins in every part of our body, because that's the way that the toxins come back from every cell. The venous flow brings all the toxins, so we have to make sure that we are draining properly. So deep breath helps the lungs to detoxify, and it helps the brain too. Kidneys, we help the urinate, also our toxins, and also our mind is very important. So first thing is evaluate our patient, find out where do we start in the treatment, and then we open the channels of detoxification. Some of the patients are candidate for EDTA or chelation therapy for heavy metals and lead, this is one of the most common triggers for cardiovascular disease. We also use some nutraceuticals through IV or oral. We do the emotional work or release, because sometimes there is something that they are holding in and they haven't worked that out, and that's going to be heavier for our patients to have a better outcome. The dental, as I mentioned, is very important. Structural alignment with a kinesiology, applied kinesiology chiropractor, which is plays a huge role putting your structure together. It's very important also to have metabolic typing and the food according to your every individual needs, and exercise according to your needs also is very important. We have seen that triathlon, they have too much oxidative stress, they are overwhelming their bodies, and they are already burning themselves and their adrenals. So we have to make sure where they are to recommend exercise programs. Dental care, if the patient has mercury or has been exposed to lead or any other metals, or they have galvanic problems because they have gold crowns and they have mercury and they are creating some energetically problems, then they can have arrhythmias, they can have also a lot of other issues. Our biggest organ that we focus on is in the GI tract. It's a cleansing. We have to detox, we have to repair the damage that it has going on in your stomach, especially in the small intestine or in the pH of your stomach, in order to help your absorption and digestion of B vitamins, vitamin K, vitamin D, and all these liposoluble vitamins, and as well everything that prevents heart disease. So some of our recommendations is paleo fiber, probiotics, balanced essential fatty acid, digestive enzyme, and hydrochloric acid. This is one of the most important, and it's a step-by-step. As you can see, your digestive tract starts in your mouth. So let's start from there. Let's start from cleaning your mouth. Then we go to the 5-hour program that is removing and replacing and renew, and just make sure that you don't have any bugs, any microorganisms, and then try to bring that balance into your flora and your intestines. Is very important. And this is a powders form of fiber and good flora and essential fatty acids and digestive enzymes, and that it will help to reduce the stress in your stomach. If a patient has insulin resistance syndrome, which is probably one of the most common diagnoses now in and this year, and it continued to do so because there is going to be more obesity, according to the statistics. But what I'm trying to do is send this signal to avoid to be part of 2020 statistics. In homotoxicology and homeopathy, we have Syzygium compositum from Hill Company, and lymphomyosot and berberis and Nux vomica. A combination of these homotoxicology remedies will help you to send a signal into your organ to help the body to bring that balance and detox, and it's very important. Our lipoic acid, it's probably one of the most important for insulin resistant. Ribocarniclear, obviously your essentials from USANA, Biomega, Proflavanol C, CoQ10, and additional resveratrol. It's one of my top recommendations, as well with Cardio K and D in patients that are not taking Coumadin. Cardio K and D, is a combination of vitamin K2 and also vitamin D. Is the most important recommendations for me that we have learned over the course of the years. If a patient is complaining of metabolic syndrome, where already there is diabetic, it's no longer insulin resistant, that there is already patient who have diabetics with other health problems like cholesterol, like more advanced conditions where we have homocysteine supreme, metformin. I think is one of the most safest and the most recommended medication that we use here for polycystic ovarian syndrome or any other insulin sugar problems. I think it's the most safest medication that we can use. Chromium, we have Prom omega blood sugar as a combination of omega 3, 6, and 9. And also Protandim, which is a very good way to increase your antioxidant enzymes and reduce your oxidative stress. If there is a C-reactive protein elevated alone, which is very common too, the bioinflammatory plus from functional food, it also is very good to reduce the C-reactive. It has bromelain, it has other nutrients that will balance your inflammation that can be coming from, but definitely we have to ask why there is a C-reactive protein high. Where is this coming from? If it's a dental, the GI tract, or where is this coming from, is important to address. Cortisol manager, normally these patients, they have stress 24/7, 360 days. And so normally they have high cortisol at night and they are unable to sleep. They have insomnia, they have night sweats, they normally have fluid retention. So cortisol manager at night, it will be very, very good option. Curcumin, quercetin, and AO booster from USANA also could be very important. If a patient has high blood pressure, high cholesterol, the red yeast rice mimic what statins are doing without the side effect. Nevertheless, ask your doctor if you're candidate for red yeast rice, niacin, CNO, garlic, keolic acid. Garlic, it's one of the well-known research in if a patient already has atherosclerosis, they already had stent, they already had bypass. Well, keolic acid, I think, is one of the most important to reverse, because they have studies that they have reversed coronary disease. So I think it's very important to address this. Lipid kit from Dr. Houston, I think is one of the most important also combination of nutrients that will help to reduce your high cholesterol. And I just want to make clear that I'm talking about high cholesterol. I'm talking about the size of the molecules. We're trying to avoid thinking of cholesterol as the total number, or the LDL or the HDL. We're talking about other forms of particles. The size of the particle, because a patient who have, an example, I have two patients, A and B. If both patients have the same cholesterol, let's say 250 cholesterol, they have the same HDL and same LDL, and one or the other could have higher risk, because those molecules are very small. And if they are very small, they are easier to cross the blood barrier in the endothelia and create more inflammation, stress, and obviously create more lesions and oxidative stress. And that's what I'm talking about. So this is a protocol that you can use to reduce this event. I'm not saying that everything you should take in any of the recommendations. I'm just doing a summary of what we use and what I recommend normally in our patients, and we just select each one or the other. For high blood pressure, definitely magnesium glycinate, and we have a product, the MG Plus Guard. I think it's great. It has a combination of multiple magnesium forms, glycinate citrate. The yucca, I think it's a very powerful anti-inflammatory herb. Bain Light has salvia, and these herbs that I think it's great. I have seen it and it works great. Potency Guard, L-arginine, CoQ10, homocysteine supreme, and proflavanol are one of the most powerful tools that we use for high blood pressure. Folic acid and in activated form also is very, very important, because L-arginine and folic acid are the precursors for nitric oxide. Microscopic blood analysis here at Sanofi help us to evaluate the severity of our patients in oxidative stress. It could be the patient could have a very good dry sample or have a lot of oxidative stress, and also fibrinogen, and that is going to make the cells more sticky, and that can create more of the white spaces in the middle. In the live sample, you can see in your left, it's a normal, and in your right, you can see there's a lot of Rouleau formation, that cells are stuck, and they have some white spaces there that could be related to fungus and liver stress. At the end, but not least, I think that one of our approach is to, once you are organized, once you see our patient, you evaluate and organize all this information, and you already start a plan. You already treat the underlying of what is making the patient at risk, and then the long-term and prevention will be stem cell. The stem cell, I think it plays a huge role on repairing the damage that already has been over the last 10 to 15, 20 years since you started smoking or drinking and affecting your liver or any other exposure. So this is the way that you can repair the damage. We can use your own cells, and I think it's great. I think this is one of the most ultimate treatments. And now this article that I just put you there is coming from Europe, and they found how to make a cancer cell to become apoptotic, or apoptosis. Apoptosis means programmed cell death. So normally our cancer cells, they don't know how to die. So this is a way to send a signal. It's a microRNA and throughout the stem cells, and we can let that signal to the cancer cell to die, and instead of being and still don't having this information. So I think this is the best way to repair. And I'm speaking about cancer because, as you know, as you saw in the second or third slide that in my lecture, I put there one of the most top 10 killers. It's cardiovascular and cancer. So why are together? Is because there is a lot of sugar, there's a lot of insulin, there's a lot of stress, and the environment it's interacting with the genetic of our life, and so this is the response of our body to defend against these changes. So recommendation is smile, vitamin G, enough vitamin G from the ground, do what you like to do, and enjoy. Well, from me, this is Dr. Isaac Mesa from Sanofi. I hope the communication and I don't see any faces or smiling, so I hope the sounding was great. The slides were able to see in all of you, and looking forward to see you soon here at Sanofi Medical Institute. Thank you. If there is any question and answer, I we'll try to go over question and answer area and see if there are any. Thank you. I see there is a sounds is good now. Okay, yeah. Oh, very good. Okay, let's find out. The first, I'm not going to say any names. I'm just going to say there's a question here. They're asking about standard American diet relevant to low vitamin D levels or just bad circadian rhythm, melatonin, sleep cycle. We're talking about standard American diet. And it probably could be overwhelming, this word, because not all the Americans have high glycemic index diet or so nevertheless, we're talking about when a patient has a high carb diet, they are not eating according to the metabolic typing. Every patient should be eating according to what metabolic typing is. I think you should find your diet that fits for you. When I'm speaking about low vitamin D, it's huge. Normally, patients with vitamin D deficiency, they normally have, they are not exposed to the sun. They are working indoor. They are wearing sunblock protection, and most of the patients they have they live in the north. They have low vitamin D. And I think that affects totally the circadian rhythm, the melatonin, and the sleep cycle. And when I speak about sleep cycle, there are patients who have sleep apnea, and there are patients who have sleep deprivation. So it will be important to understand that sleep apnea is very common, and we don't know. We don't go to the consultation to visit our doctor when we're snoring. If a patient snores, it's very, very important to go see your doctor and to rule out the sleep apnea. Why? Sleep apnea is an obstruction of the airway. When we are sleeping, most of the time, your breathing is very shallow, is very slow. And when we snore, that means that there is an obstruction of the airway, and that means there is less oxygen going into your brain, into your body. So what are you going to do when you have low oxygen to your brain, into your body? What is going to happen? When you eat a heavy protein and high carb and high starches, what do you have? You just get sleepy. You get drowsy. You get foggy mind. But imagine having that low oxygen chronically for 8 to 9 hours at night, when your body needs all the oxygen to repair and produce hormones. Then that means that your body will not repair, and what the other way around is going to create hormones that is going to create more stress in your body because you have less oxygen into your body. And I think it's one of the most critical conditions that I normally address every time that I see a patient with obesity or overweight, or any patient who have short neck or small jaw, or they have a TMJ problem, or they have any of those conditions, including neck problems. I normally address this condition. So for a patient who asked this question, I hope I answer yours. I'm gonna go fast, okay? Because we have to respect your time and my time. So Protandim. No, I think Protandim can be combined with any of the USANA supplements. It has different, any problem just taking the Protandim? The question is, any problem just taking the Protandim and all of the USANA nutraceuticals without everything else? Mention it. I don't see any problems. They both have an objective, and the objective is reduce your oxidative stress. If you reduce your oxidative stress, you will be balance your antioxidant and your oxidative stress, and that also can prevent heart disease. But remember, you have to treat your underlying. If you're sedentary, if you don't drink water, if all the other condition if you're smoking. So it's very important that you start activating and move your body, and also vitamin G. Oh, thank you for the great call. And let's go and move. Thank you for information. Okay. Okay, thank you. Okay. I hope that the question that I only have 6 more minutes, but this question is about CMT. I don't know. I don't understand. Can you put the whole name there? It says here, how can patient with CMT disease can be helped with USANA Nutritionals? It will be good if they put me the full name. Let me continue. Okay. I mentioned about fibromyalgia. It's a precursor to more serious disease. Does that mean that if the patient did not become ill with fibromyalgia, they might have had a cancer instead? Okay. When I mention about fibromyalgia being the beginning of an imbalance of something, fibromyalgia is telling me right now, as a doctor, that there is something going on. It could be energetically, it could be dental issue, could be including MS. Something is going on, and I need to figure out. So that's why it's going to be important to ask questions. Why? Since when you start with the symptoms, what happened in your life? Most of the patients, they normally tell me it's either a young female started after they started the menstruation period. Sometimes they normally after the first pregnancy, after an accident, after a trauma, car accident, or after I had a severe problem in my marriage. So there is always a trigger. So what we have to find out is where this is coming from, and not necessarily every patient who has fibromyalgia will have a cancer or will have a heart disease, will have something. No, it's not correct. I'm saying that fibromyalgia is the beginning of something. And if a patient has a good genetic in the family and the environment is okay, and he only has fibromyalgia, well, it's most likely it's going to be some emotional or energetically, or it could be vitamin D deficiency or other nutrients, or including a very simple dehydration and dysbiosis. So the combination of both, they can create foggy mind, and a lot of other problems, including only stress. So I hope I answered the question about fibromyalgia. Cancer is one of the most difficult situations, and it's not related directly to fibromyalgia, but there is definitely a link between that and chronic disease. Metabolic typing, there is a question there. Here, the nutritionist, they have a way to, it's kind of an energy test. They put your body to a challenge with glucose, and they are trying to find out how your body reacts to a certain type of diet. And in about 2 hours, they do a different testing of your sugar after a challenge, and they check your blood pressure and they evaluate how your body reacts to a specific diet, and then you can enter a category. You can enter to an area of a specific diet. If it's raw, it's better for you. If it's protein or carbohydrates, or what is the type of diet that you should be eating according to your metabolic typing. I definitely think that this is very important because genetic, we all are different, and we all have to find our diet. And the way that we have to do it is just to have a good functional medical consultation with your nutritionist, and then you will understand what is the best diet for you. Very good. We only have 2 more questions, and then the last, hope I will, if you are able to send the rest of the questions to Sanofi blog, and we will be happy to answer most of them. I will be taking USANA probiotics, fiber G, this and that. Okay, all right. I would like to do a cleanse to purify my body and cells. What kind of cleanse? Okay, a patient is asking what type of cleanse a patient can do if they are taking already the probiotics, USANA supplements, fiber, digestive enzymes, Eposil. if a patient needs live an active life, suffering, hiking, surfing, sorry, hiking, and running. That's a very good question. I mentioned in the lecture that liver, colon, kidney, lungs, and the skin are the most important organs to detoxify our body. So all depends on where you live. I think depends on where you live and what have you been exposed in your daily life activity is the severity of the intensity of the cleansing that you should do. Especially just follow your body emotions and also your intuition. Depends on the symptoms is going to be also important. So if you don't have any symptoms, you're healthy, well, it will be once a year probably a cleansing. But it will be good to have your microscopic blood analysis test in order to find out how toxic you could be. And that way you can give an idea what kind of cleansing you should do. But for my recommendation is sauna, colon hydrotherapy are one of the most important, and sauna, and obviously lymphatic massage. I think those are the most important that I will recommend. Also body wrap also will help because the skin is the most important organ, and your colon and your liver also, so you can do that and continue with your HEPA seal. Okay, dokie, let's go further. Okay, that's the last question that I have. Well, thank you for listening. There are, for the persons who are around the world, here is Dr. Isaac Mesa, and I'm looking forward to seeing you soon. And God bless and happy holidays, and see you soon. Bye-bye.